Good morning or good afternoon, depending on where you happen to be in the country. My name is Mark Perino, and I serve as the president of the American Association for the Treatment of Opioid Dependence, more commonly known as ATOD. Today I'm introducing the COVID-19 Impact Report on OTPs, which we developed in conjunction with our board of directors and recently released to SAMHSA and other federal and state agencies which have jurisdiction in this area. It's fair to say that, like the healthcare system and our country, that the OTPs faced a severe impact when COVID-19 really hit during mid-March of this year. And the COVID-19 report traces 6 months of responses from the OTPs from March through the end of August. It's fair to say that at the beginning, we had to ensure that there would be adequate medication getting into the OTPs, since the OTPs were submitting larger than normal orders. This meant that pharmaceutical companies had to have sufficient quantity and that the DEA would approve it as well. We achieved that. The next major challenge was having personal protective gear, and this was almost impossible to get during March and through the end of May. Fortunately, having access to such PPE has stabilized and programs have adequate supplies. Fortunately, SAMHSA and the White House Office of National Drug Control Policy provided critically needed letters so that OTPs could be declared as essential medical services and then would be able to get personal protective equipment on par with hospital settings as well. There were other challenges because the OTPs were not set up for social distancing. Keep in mind the essence of the OTP are they are significant outpatient treatment centers treating a significant population of patients at any point in time. Also, we learned that in spite of the fact that a lot of medication was being administered based on working with the state opioid treatment authorities, the SOTAs, and SAMHSA under blanket exemption provisions, so that people who were stable and even those who were less stable would be able to access take-home medication. I have to admit that we anticipated that there would be greater reports of misuse and potential overdose. That was not to be the case, and we are grateful for that. We also think that's related to the fact that patients are able to handle their take-home medication in greater quantities, and also that the programs were monitoring how well the programs were doing. Additionally, and maybe a confounding factor, which is noted in the report, is that toxicology reports were returning positive, notably for heroin and fentanyl. So it's a complex story, and this will be needed to be sifted through before any change in regulatory oversight will be contemplated, especially in extending take-home medication. We also found that telehealth, telecommunication services increased markedly, and that's reflected in the report findings. Some patients did well and some did not. Some of the less stable patients do better with face-to-face counseling, and some of the more stable patients preferred the greater confidentiality provided with the telecommunication. Additionally, there were challenges with third-party reimbursement. Medicare was quick to adapt to allow telecommunication, not necessarily telehealth, to be used in the OTP setting with their patients, and this did provide greater flexibility. With regard to Medicaid programs, there was much less flexibility, and that became an issue for a number of our state chapters. Some were successful, while others were not. Ultimately, the system did adapt, and I'm happy to say that patient infection rates and staff infection rates were lower than anticipated. When we sent out the first blog post on March 20th, 2020, I anticipated, as did my colleagues, that there would be higher patient infection rates. I think the issue of the take-home medication, the social distancing that could be done at OTPs ultimately helped. And so from my point of view, the OTPs and the staff did a remarkable job in providing continued coverage for the patients. And I'm grateful for the patients who were able to be patient with the system as we adapted, and certainly to the courage of the program staff. So I hope that you find the report to be useful. We know that we are still in the middle of a pandemic. It's by no means over. Hopefully a vaccination program will be available shortly, and we will see a better social adaptation across the board. So I think that you will enjoy this. We'll provide further information as we get more material based on our collaborative work with research groups like Johns Hopkins. So thanks again for the opportunity, and I hope that you find the report to be of value.